Hi everyone, I am Dr. Shanthala Thuppanna, Consultant Gynaecological Laparoscopic Surgeon and Robotic Surgeon. I work as a head of the department Gynaecology at Sakra World Hospital. I will be speaking on fibroids. These are non-cancerous growth, tumors we call it as, which grows inside the uterine muscle layer, and it's very common. So when the fibroid is too grown, too much big size, they give pressure on the urinary bag, that is in front of the uterus there is a urinary bag. They compress on the urinary bag. They causes frequent urination, means the bladder will not be able to withhold urine too much. So when it is pressing on the bladder, if it is filled little bit amount, they feel like passing urine frequently. Some patients, even when it compresses on the posterior surface, back, that will be intestinal area. So some patients complain of back pain and some even constipation. So these are something pressure symptoms. Sometimes bulge, swelling on the tummy. And when we come to fertility related, some patients, when the fibroids are on the inner lining of the uterus, they come with the infertility also when it is too big, because the implantation failure can happen in inner lining fibroids. So sometimes abortions, because if the pregnancy is implanted on the inner lining fibroids, they may not grow to a bigger size. They come with a painful bleeding on and off, and they may have abortion also. And other patients, sometimes they can lead to preterm deliveries. Before the expected date, they can have preterm deliveries, and the pain during the pregnancy, because there are certain changes which are happening in the fibroid, that is something like a red degeneration. They can cause painful cramps during the pregnancy. So how we diagnose these kind of fibroids? So usually diagnosis, as I told, some unexpectedly when we do routine health checkup, they are diagnosed. Otherwise, on examination, we can do our internal examination. Some patients will have a uterus which is more bulkier than normal size, then we diagnose. Ultrasonography is very common. By internal scan, we can localize the number of fibroids, the size of the fibroids, location of the fibroid, and when we see multiple, when we are suspicious, even a MRI can tell in depth how many fibroids are there, locations, everything. We can diagnose fibroids.